Hello, everyone. So here's part 3 of the movement series that I started of professionals that are regulated. Now, I am referring to healthcare professionals in Ontario, but this is also true to some other Western countries, such as the United States. And it may be so in other countries as well, but they may not be regulated. So just remember that I am speaking of more of the Western world, but in some other places, kinesiology is definitely a study and people do study kinesiology. So let's get into it. So what's kinesiology all about? But before I do that, I have to ask you guys a favor. This is a huge favor. If this is your first time watching, please watch. If you like it, please subscribe and like and make a comment. That'd be awesome. And if you have been watching my videos, but you're not a subscriber, please do so, because that's how we get recognized. And then I know that I'm doing a good job. And also, if you can like my video, that would be fantastic as well. So now that that's out of the way, I feel like I'm marketing myself constantly by asking you guys to do this, but truly YouTube that does require this, so that there's certain things we can do. Not so much monetization, but also branding, so that I would really appreciate it. That's all. So kinesiology, movement. It's all about study of movement. Now, physiotherapy and occupational therapy, which we talked about in the previous two, so number 1 and number 2. Physiotherapy is more about rehabilitation, and so is occupational therapy. Kinesiology can be part of rehabilitation, but the study of kinesiology is the basis of movement and study of movement. So let's go and look at the definition, as we have done in the past 2 videos. So let me share my screen with you, and then we'll go to the slide, and then if you wish, you can stop the video and read it on your own if you would like to take more time. But this comes straight from the Regulated Health Professions Act. So kinesiology is the practice, is the assessment of human movement and performance, and its rehabilitation and management to maintain reliability, to enhance movement and performance. So it's all about movement, performance, and how to maintain or enhance that movement. So now we'll just go to the next one and talk about a little bit about where it is and where kinesiologists you might find. So kinesiology is the science of physical activity, movement. It is a study of the impact of the physical activity on health and society. So how someone moves and how that is healthy. So that brings us to sports, because we know that exercise is an important and integral part of our lives. And my apologies soon, or well, there's a kitty cat coming here who wants to say hello to everyone. But similar degrees to kinesiology, and there can be a bit of confusion. We already talked about physiotherapy, but exercise physiology is a little bit different, because exercise physiology looks at specifically how exercise and movement, what it does for our, how we create energy, our hormones, our well-being, how we perform, meaning in the muscle, how we make energy. So all of that is more cellular and more what we call physiology, or function of how things function and create energy and movement, versus actual physical anatomy like structure. Versus kinesiology moves, sorry, there's a kitty cat here. He says hello and he's moving around, and because of him I have to move. But kinesiology is not just that, but it says, is this normal range of motion? Is this normal range of motion? Well, how much energy do I need to do this? What is normal? What is not? Now, I have a particular issue with my ligaments where I'm very loose. So a kinesiologist would assess me, and actually 2 kinesiologists found out, and they found that there was something not right with my joints. So I can thank them that they knew what they were doing, because they were my personal trainers. Now, sports medicine is a little bit different, because it looks at injuries and how to prevent injuries and also deal with injuries. But it's also usually sports medicine is done by medical doctors who may study kinesiology and exercise physiology and so on. Now, kinesiology is also studied by many who do decide to go into physical therapy, nursing, and coaching. So for example, I used to teach nursing, and I did have a student who was a kinesiologist, and he worked at a physiotherapy clinic, and they specialized in neurological, I mean, all in everything, but a lot of it was for spinal cord injuries, neurodegenerative disorders. So his job was to actually assess them and make sure that they were moving and being placed while they were exercising into proper anatomical position, because that was his job. He knew what was proper alignment. Versus just an assistant, these guys were a little bit more trained to make sure that was properly done. A lot of personal trainers and coaches do have a kinesiology background. And like I said, my experience with kinesiologists has been in the capacity of personal trainers. And I found that their assessment is very detailed and very good. And they're able to see that if you have any issues, they can identify them so that when you're training, you're making sure that you're training properly, depending on how well you're moving or what you're trying to achieve. They also can work in physiotherapy clinics, like I said, and they can be part of the assessment process and also setting up clients for complicated exercises, such as in spinal cord injuries. And they basically look at normal movement, range of motion in normal life, and also in sports performance because of exercise. So if you think about it, with kinesiology, with physiotherapy, occupational therapy, they also would work together with exercise physiology in sports medicine, nursing, and coaching. So all of these can work together to make sure that movement, the energy and the ability to create movement, and also to prevent injuries, these are all integral parts of us being able to do everyday activities of daily living, but also be able to exercise and sports. And I do appreciate, excuse me, I'm going to let Tango say hello. He's purring very loud. He's lovely, but he's very heavy. When he's sitting on my laps, I have a hard time actually focusing or moving. Speaking of movement. But one of the beauties of all the things that we've done with movement is that now we know that if you require a particular treatment modality or you have a particular problem, now you know and you can request, who would I see? What would I do? For example, if you want to go and work with a personal trainer, and they may say, well, I have a kinesiology background. Now you know where they come from and what they do, and that they can really help you in moving properly and proper function, and not just for the exercise component, but they can help you to excel in sports, but also to be able to function from a daily, day-to-day normal functioning. Now, when it comes to physiotherapy, like we spoke before, those are all if someone had any injuries or needs anything to work or rehabilitate. Again, a physiotherapist is wonderful. And an occupational therapist looks at function, but activities daily of living and any kind of assistive devices. Now, as we have talked about all these different things, and I'm not going to repeat all the things that their definitions are and so on, there's something else that they can do, and especially even physiotherapists and kinesiologists, I think that occupational therapists can do as well, is that they can also practice complementary therapies, and nurses can as well. But I'm going to introduce it now since we're at the end of the movement series, is that, for example, a physiotherapist or kinesiologist may have a certificate in acupuncture, so they can help acupuncture with pain, or even to have a muscle not be so stiff if there's any blockages in the meridians. The other thing that they can do is they can do a little bit of light massage, stretching. They can also do energy work, or we call it energy work, but it is hands-on therapeutic touch, for example. Reiki is very popular. I'm trying to think what else. Some people call it health touch. So there's a number of different ones that they may use actually to help their clients. And this also is true in nursing. Now, I believe occupational therapists also do some mini mental or assessments around mental health. And all of these could potentially study also to do some psychotherapy or hypnosis, or some guided imagery or meditation for the clients if that's required. So remember, as much as these are the basics, we can add and layer on to these therapies that all of these professions are doing it. And I'm really distracted by this cat. If anybody has a cat, he's very persistent right now. He wants to be here. So he's here, whether I like it or not. But anyway, so I just wanted to introduce that component, and I will actually start talking about the different areas of nursing and in different areas of complementary therapies within nursing. However, at the same time, I will continue on with my series of all the different professionals so that we get them all covered, because I think it's good to understand, well, who is a nuclear technologist? What does a medical lab technologist do? Who takes your blood and how do they get trained? How do you know who does your ECG, measuring your heart? Nurses can do it, but certainly there's technologists. And a lot of these professionals are regulated. So they practice confidentiality and privacy. They have an ethical standards, and they have a knowledge base that they can take information from and apply to all their clients. So we'll continue with all the different series. And I think probably after I start into the complementary therapies, I will start into all the medical diagnostic professions, because they also do some very in-depth studies, and they can do different things within those areas, but it's quite intense and they're very good at what they do. So it's really important to understand that there's just so much there, and that they have a lot to do with diagnostics and also your well-being. And they are trained just as nurses, just as physiotherapists, just as physicians, in best practice guidelines, patient-centered and family-centered care. They all have something to do with jurisprudence, meaning how do we, what is our ethical models, and how do we work with our clients in that therapeutic relationship? Because in the end, all the things that we do it in a relationship that we call a therapeutic relationship. And that means that we're doing everything in a therapeutic way that is for the benefit and the healing of our clients, so that they get better and they get to go home. And that's it for today. And I hope you guys enjoyed this series. Please do tell me what you think. And if you're a physiotherapist, occupational therapist, or kinesiologist, do give me feedback, as I do like to know how I'm doing, because I'm just curious. I'm always learning too. Just because I'm teaching doesn't mean I'm not learning, because life is about continuous, unending learning. So on that note, be well. And in North America, if you are celebrating, it's the long weekend, enjoy your long weekend. And if you are in Toronto, just so you know, there's 2 more days of the air show on. Enjoy. Take care. Bye-bye.